Cancer is the name given to a collection of related diseases. In all types of cancer, some of the body cells begin to divide without stopping and spread into surrounding tissues. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and divide to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place. When cancer develops, this orderly process breaks down and cells start to form abnormally, which cause tumors in the human body. There are many types of cancer treatments. The types of treatments that you will receive depend on the type of cancer you have and how advanced it is. Although there are many treatments patients can perform, not all treatments are effective due to the development of cancer in the patient's body system. Researchers have found that the three most effective treatments for advanced cancer are immunotherapy, radiopharmaceuticals, and ablative techniques. Immunotherapy is a type of cancer treatment that boosts the body's natural defenses to fight cancer. A research conducted found that increasing T cells exposure to potassium or mimicking the effects of high potassium could make cancer immunotherapies more effective. The study stated that immunotherapies had led to remarkable results for patients' cancers, eradicating difficult to treat tumors and in some cases causing complete remission of the disease. Radiopharmaceuticals are a group of drugs that contain radioactive materials that have been dissolved into liquids and that can be put into a vein. They travel through blood and are drawn to areas of bones that have cancer. The radiation given off by the drug kills the cancer and relieves bone pain, but it does not cure the cancer. If the cancer has spread to many bones, this type of treatment may work better than using radiation, which only treats a small area. Putting a needle or probe right into a tumor and using heat, cold, or a chemical to destroy it is called ablation. It's used most often for cancer that has spread to the bone or liver, but may be used in other areas too. It's most often used when only a few tumors are causing problems. A common type of ablation called radiofrequency ablation uses a needle that carries an electric current. The tip of the needle is put into the tumor. Ultrasound or CT scans may be used to be sure the needle is in the right place. An electric current passed through the needle heats the tumor to destroy it. RFA is usually done while the patient is under general anesthesia.
I had about at best maybe 18 months to live. I was out of hope at that point. There was nothing left to do except try this new clinical trial. Went into the CT scan and they found a 3.8-pound tumor on my kidney. The doctor then explained to us that what I had was renal cell carcinoma, or an RCC, kidney cancer. The initial steps we took after we discovered the tumor was surgery to remove the tumor. Everything was looking fine after the surgery. I went back to work. I was feeling pretty good, traveling a little bit, and I went in for a scan and they found a second tumor that had kind of wrapped around my adrenal gland. It was on my vena cava and kind of moving down into my liver. I had developed a blood clot, which kind of put back the surgery until 2013. At that point, they opened me back up again. They told me that they couldn't remove the tumor because it had wrapped around, like I said, my vena cava and moving into my liver, so we were gonna have to have another option, which would have been chemo at that point. We just thought there had to be a better way. My wife was on the phone, emailing, asking questions, and just trying to find a better answer than traditional chemo. My wife and some friends found MD Anderson, and we went down and talked to the surgeon there and our oncologist, Dr. Tanier. That's how we discovered the Opdivo treatment. He said there was a new drug out there that doesn't have a name. It was a number. He said, we're going to try to get you on it. And it basically takes your immune system and turns it on to fight the cancer. After the first 3 months to hear Dr. Chenier say, well, the tumor's reduced by 30%. You know, my wife and I are like, holy wow. You know, that is awesome. Each time we went back and I had scans done, the tumor had reduced quite a bit. I could feel, you know, my body getting stronger. You know, I had more energy, I was active, I was putting on weight again. My doctor wanted me to gain weight. My spirit started lifting, you know, with each scan and each treatment, you know, it was kind of like I was going in to do battle with this tumor. Now after 3 years, it was 3 years in March, I came off Opdivo, nivolumab, and the tumor has basically disappeared. I'm doing fine, I'm working, back at work, we're traveling, just enjoying life. I would really like to stress that there needs to be more funding for these types of drugs, for immunotherapy drugs. You know, I'm living proof that the drug works, and, you know, if it can work for me, you know, it can work for anybody, you know, and I just would like to see cancer eradicated at some point in my lifetime.
More than 15.5 million Americans with a history of cancer were alive on January 1st, 2016, most of whom were diagnosed many years ago and have no current evidence of cancer. The number of cancer survivors has increased substantially in the United States during the past few decades. As the number of cancer survivors has increased, the importance of understanding more about the production of cancer is essential to the increase of survival rates.